Media personality Lorna Irungu has become the latest high-profile Kenyan to succumb to COVID-19 related complications. Nakuru country's chief officer of public health, Samuel Kingori, is also among the 12 people who've died from COVID-19 in the last 24 hours. The deaths come as the positivity rate shot up to 22%, the highest this year. And as Dorcas Wangira now reports, the government is warning that Kenya's health facilities are currently overstretched.
As the crisis continues to unfold across the country,
I battled with health issues, and I have never been shy to talk about those because
media personality Lorna Irungu succumbed to COVID-19 related complications at the Karen Hospital. Lorna, who was a former managing director of Ginadine Group Communications, had for 20 years bravely battled lupus, a long-term autoimmune disease in which the body's immune system becomes hyperactive and attacks normal, healthy tissue. She underwent several kidney transplants and was vocal about her fight with the disease.
And I always thought about being authentic and just saying this is who I am and this is what's happening.
In Nakuru, the chief officer in charge of public health, Samuel Kingori, also died of COVID-19 related complications. He had been hospitalized for the last few days and had shown great recovery until 9:40 a.m. this morning when he suffered cardiac arrest. The two were among the 12 people whose deaths were reported on a day the country posted its highest positivity rate this year, 22%. A whopping 1,130 people tested positive out of a sample size of 5,119. This means that out of every 100 people tested, 22 tested positive. The government says this is a sign of high community transmission and that there are likely more people with coronavirus in the community who have not yet been tested.
But even as we continue to battle this third wave, of which I cautioned you would come with a vengeance, the only way to curtail the spread is to ensure that we strictly adhere to the containment measures that we have advised. It is unreasonable for you and for the government and for others acting in good faith to explain to a person that you are walking into a hole by not wearing a mask, by not doing whatever needs to be done. You save my life, let me save yours.
Kenya's cumulative number of cases now stands at 122,040, and concern is growing over the capacity of health facilities in the country to handle the spike.
Our health facilities are currently overstretched, but this does not mean that they have been overrun. We have witnessed a huge number of hospitalizations lately. The number of those being admitted at our intensive care units has especially shot up.
On January 22nd, there were only 27 patients in the ICU unit. March 22nd, there were 120 patients in the ICU, an increase of almost 4 times. On January 22nd, there were 1,553 patients on home-based care. March 22nd, the number has risen to 2,553, an increase of 1,000 people in just 2 months.
We can very easily get discouraged. However, I want to assure Kenyans that we are still fighting to get adequate ICU, high dependency unit, both at our national as well as county referral hospitals.
With Nairobi and neighboring Machakos already overstretched, with no ICU beds available, the Kenyatta University Teaching and Referral Hospital plans to unveil 30 new intensive care unit ICU beds to add to the current 32 ICU beds which are fully occupied, with the hospital struggling to admit more. Nandi County has 15 ICU fully equipped and operational beds stationed at the Kapsabet County Referral Hospital. The Kenyatta National Hospital's ICU and isolation wards are also full, stretched beyond capacity. The government is now under pressure to take more measures to contain the virus. The World Health Organization recommends that the test positivity rate has to remain below 5% for at least 2 weeks before governments should consider easing containment measures. Dorcas Wangira, Citizen TV, Nairobi.